And hi, hello, you guys, and happy Acupuncture and Herbal Medicine Day. How are you guys doing this morning?
Doing
Great,
well. Hi.
Awesome. Can you
thank you.
do brief introductions with the two of you?
Okay. So, hello. My name is Dr. Phil Garrison, and I am the Senior Director of the Master's Program here at AOMA and also Distance Education.
Hello, my name is Violet Song. I'm the Senior Director here at AOMA of Clinic Excellence Doctoral Program and also Herbal Department.
Thank you. How did you both get into acupuncture and herbal medicine, and then how did you find your way into AOMA? Phil, do you want to start?
Sure. So I lived in a place in California where there was an acupuncture school in town. And I had moved there after college, and I was doing some odd jobs as I was trying to play music as my primary career. So I was doing odd jobs and then playing gigs at night. And at the time, my partner had injured herself at work, and she'd fallen down and was having really bad back pain. But when they did MRIs and they did other types of imaging, no one could figure out why she was in so much pain. And so she started going to acupuncture, and I started, I could see the improvement with her. Meanwhile, one of my odd jobs that I was doing was I was working as a one-to-one aide in a special needs classroom in California for students who are 18 to 25. And I was working particularly with individuals on the autistic spectrum. And so she came home one day and said, "Hey, I've been thinking about going to acupuncture school. What do you think about that? Would you come? Would you be interested in coming with me?" And I said, I gave it some thought. And the next day I went into the classroom. I sort of looked around and I said, "Hey, here's a really underserved population. And I bet these individuals that I work with on a daily basis could get some real benefit from acupuncture, as opposed to really their only option being medication for many of them." And so I gave it more thought, and eventually I decided, hey, you know what, if I did acupuncture, I could still probably play music and do my own thing. And so I enrolled in acupuncture school, and in 2006, January of 2006, I began my studies of Chinese medicine.
That's such a great story. And there's many great personal attributes that had inspired you to join into the practice, which I think is very true for a lot of people.
Indeed.
And Violet, what about you? How did you go into the study of integrative medicine and acupuncture, Chinese medicine?
Yeah, so my grandfather and earlier generations, they were TCM practitioners. And so when I was very, very young at that time, that at my grandparents' house, that they have Sheng Han Luan, or those books, like the typical TCM books. And then in China, that the education system is a little bit different. And so when I graduated from high school, that's the time a lot of times that students are going to pick what major you wanted to get enrolled in the college. So for me, is that medical field has been always my passion. And so we have to choose what major to pick. I choose pretty much half of biomedical school and also half TCM school. So the reason I choose TCM school is actually, to be honest, the pressure from family. So it is that this is from our earlier generations has been doing. So you need to keep that going. And so I did choose that. And then it ended up that I joined the Chengdu University of TCM, and then started my journey there. And to be honest, at the beginning, I was not that much have a big idea how TCM is like, and then started from there and learn more and get more interested in it. And then in 2007, when I was completing my PhD at Chengdu University, and I met the China study group from AOMA. And then I was the translator at that time and helped with AOMA group. And then got the job opportunity and joined the interview and came to AOMA. So that's how it happens like that.
No, that's great. And I definitely think that that's a fantastic story. And I think it's nice that both of you guys have such personal relationships to your start with acupuncture, even if one of them is, you know, you helping your partner Phil, and then but you also like your longstanding like family within the same field. And you both have been in the field for, I'm gonna do like quick math, but a number of years, just to say. So over that time, either before or during your time at AOMA, what have been some of your favorite experiences that you've had with clients or students or other faculty and staff?
Yeah. Violet, do you want to go first this time?
Oh, sure. Yeah. So definitely there's a lot of great experience actually, because I'm also a faculty and also a practitioner at AOMA. So for students that I really enjoying every class that you can see that right now I'm also very actively teaching, because I really enjoying this time that in class and have communicate with students. A lot of times it's not only I'm introduce TCM herbs to students, at the same time through the questions, through the informations from students, I also learn a lot and improve a lot and change a lot of like the old mindset a lot. And at the same time in clinic, the same thing. I feel that I learn from my patients also. And a lot of times that you would find out every treatment, maybe it's just like a little bit change. But after a procedure of like a whole course of the treatment, and then we would find out fantastic results. That's the time that I'm so grateful about this medicine, and also that's the part that I really enjoy about it.
Yes, very similar to Violet. I have several responsibilities here. When we were introducing ourselves, neither Violet or I mentioned that we teach as well in the program. And so, like Dr. Song mentioned, working with the students is, I mean, one of my primary joys in life. I've been teaching for over a decade in the field, and when students come up to you and say, your class made me think about Chinese medicine, or your class made me think about my practice in a totally different way, something like that is really inspiring, and you know, those are the kind of things we draw on in moments of uncertainty, which I think we all have. From a clinical perspective, I'll sort of build off something that Dr. Song mentioned about kind of the incremental growth or the incremental improvement of symptoms, and how sometimes it can be so slow and gradual that people don't always recognize it. And I remember when I was first out as a new practitioner, one of my friends sent their grandma to me. And they said, you know, my grandma's kind of old and she's having a lot of neck trouble. She had a bunch of surgeries. And so I treated her for, you know, a period of weeks. And I remember he called me up and he said, oh, you're not going to believe this. I was over at my grandma's house and she reached up and changed the light bulb. And I said, Grandma, you're reaching up to change a light bulb again. And she didn't even realize that she had improved so much. It was just instinctual. I can do this. And she reached up and changed the light bulb. So, you know, I think when we have experiences like that in the clinic, it's, you know, it's always very rewarding. I had a similar experience, but different, when I was a student intern around herbal medicine, which Dr. Song and I both have a pretty substantial background in the Chinese herbal medicine part of Chinese medicine. And I remember this patient that had been treating for neck pain, and she was getting better. And then she came in one day and she said, "You've been helping with my neck, and I just wanted to mention something to you. I wonder if you could help." And she said that she was a gardener, and it was summertime, and or getting toward the end of summer, and she liked to eat things out of her garden. And she said, "Every time I eat stuff out of my garden now, I have digestive issues. Could you help with that?" And so we came up with a plan. And in Chinese medicine, often we say, make sure you're cooking your food, right? Eat a lot of cooked food. Limit the amount of raw food that you eat. And so I told her, hey, for a week, just cook your greens as much as you can. And then I gave her some Chinese herbal medicine to help improve her digestion. And then at the end of that week, I said, all right, now let's try. So before you go out there and forage from your garden, take some of these herbs, and hopefully that'll help. And she came back the next week and she was really excited. And she said, oh, I can eat out of my garden again. And I said, awesome. So keep taking the herbs, and, especially preventatively when you're going to eat out of the garden, like just to keep your digestion rolling along. And so, you see that gratitude from your patients, where you see the gratitude as a teacher from the students, and it's inspiring.
Actually, I wanted to add one thing that when Phil, you mentioned about the grandma changing light bulb. So I have been also working at the AOMA Herbal Dispensary before, and we do have one of the customer coming in to pick up herbs for her dog, and it was a little pug. So and she has been kind of picking up the herbs. The 独活寄生汤 is one of the herbal formula that we very commonly used. And so one day that she was just like sharing with me about that, because her pug had the hip issue. It's actually commonly seen in this breed, and often with degeneration of the bone. And so she said that actually one morning, her pug be able to jump onto her bed and lick her to wake up, which hasn't been happening for so many years. And so, but that's something that has coming out from the herbal remedy has been used for her pet. But of course, this is being recommended by the vet. And so, yeah.
No, I think that's a great story. And also, it really just shows kind of the duality of the medicine, that it can treat any being that, can have access to it, obviously, with the guidance of like practitioners and veterinarians. And they're wonderful stories. And I don't know if either of you guys had mentioned at the beginning that you also teach, but also that you are in charge of our master's and doctoral programs. And so it's great to hear these experiences that you guys are having, both, as learners and teachers of this practice, because I feel like a lot of students and individuals who are looking out get information from you, and you have these such inspiring and impactful, notes to give to them. And I'm sure that you speak oftentimes with your students and other people about the future of, acupuncture and herbal medicine and integrative medicine as a whole. Are there any attributes of this practice that you're excited to see happening, or that you've seen that have been in the works, that have piqued your interest lately?
Well, I would certainly say just the growing number of opportunities for acupuncturists and our graduates, that's inspiring. I mentioned starting school in January of 2006. 15 years later, when, a little more than 15 years later, when you look at what opportunities students have and graduates have compared to even 15 years ago, it's another one of those reminders of the slow and gradual progress. And, sometimes we don't always see it, but then, looking at it from that perspective, students going to work in the VA, students getting jobs now in emergency rooms and hospitals, working in hospitals for, different ailments. One of our other professors just is recently going to the Cleveland Clinic to be one of the practitioners and herbalists there. So the public and the greater healthcare field have really embraced acupuncture. And to what we see with the Cleveland Clinic is that there's even a beginning to embrace the herbal medicine component a little bit more as well. Of course, here in America, we talk about Chinese medicine, but when people ask, well, what do you do? The modality that comes to mind is acupuncture. But as Dr. Song and I could talk about for many hours, the herbal component of medicine is equally powerful. And we both shared some stories about that. So I think the opportunities are really great right now. The other thing is just something that I'm really proud of that AOMA has been able to do is when the pandemic hit, every school was forced to transition to distance education. And when I look back, and AOMA had no online infrastructure prior to like May of 2020. And so what we've been able to build in just over a year is a huge inspiration to me in terms of what we've done as a school and as a team. Some of the innovative and visionary ideas. We haven't just used Zoom and distance education as a Band-Aid, like or a stopgap measure until the pandemic goes away. We've actually improved a lot of the way that we deliver content by embracing these distance education models. And we've done it all just within, a little more than a year's time.
Yeah, I actually agree with Phil. Actually, pandemic did definitely throw a lot of things off, but there's also a lot of opportunities actually brought up through the past more than a year, and especially the distance education brought up here, and more collaboration and communication opportunities that we are be able to bring into our education here. So what I have seen that the changes happens is that at the very beginning, TCM education, acupuncture education was in the introductory process. We actually invite professors, faculties from China to bring the information from China to introduce to the US. But these recent years, what we find out that we have more and more of locally grown hybrids coming out. And so this is the one that what I have seen is that we have our US style of TCM and US style of acupuncture and herbal practice here. And we have our doctoral program, which a lot of doctoral graduates that be able to becoming the leaders, educators, and in this field. And also we are be able to have more and more new practice styles has been brought up actually in the US. So what I have seen is that the seeds has been brought in from China, from the Eastern Asian area to here. And now it has a new hybrid version actually started to grow out.
That's fantastic. I think that those are all great stories, honestly, and it just shows the resiliency that AOMA has to, embrace the change that's going on and not just like comply to the changes that are happening in the world around us, but really use that as a stepping stone to create new partnerships and to embrace learning and education and community in a way that we didn't and couldn't in the past. And as Violet was saying, with our partnerships around the world and bringing practitioners and information from China, I know that also this embrace of distance learning and more online community has only benefit as we're getting this partnership together with the Jing Fan Institute. There's a cat. I'll be the person to say that first off. In the background. The perks also of distance learning is that you get to have a nice little entrance into people's homes and be able to learn more about them. But yeah, I think that that's been also really helpful in cultivating that partnership as well.
Yeah, and I actually didn't want to steal Dr. Song's thunder, but one other piece that the distance education has allowed us to do is collaborations that we haven't done. So I'll let her talk about the collaboration that she set up. But one thing that I'm really, really proud of that we did early on in the pandemic is we reached, all the schools were in this same position. And so we reached out to some of our colleagues at other schools. And since we were doing clinics on, all these schools are doing clinics online, we actually did some clinics combined with other schools on the East Coast. So we were able to expose our students to, as Dr. Song said, different styles of treatment, new professors, diverse ideas, and they were able to get the same from us. So one of our faculty would present a case, and then one of their faculty would present a case, and the students got a chance to interact with each other and kind of start building that community of Chinese medicine here in America, even as students.
Yeah, and talking about the collaboration, definitely that we had this opportunity to be able to collaborate with our brother schools, sister schools here in the US. And also, we have, for example, here, University of Texas Pharmacy School, that they have been sending their PharmD students that to come to AOMA to do their elective courses and also externship. So, which is also something that has been brought up recently. And for the recently that we have collaboration with Nanjing University Jingfang Institute and also the Jiangsu Province TCM Hospital, which is also eye-opening experience for students here. But definitely we are also provide the guidance for students that what you learned, they have been practicing in China. And then what can you do, what cannot do in the United States in our circumstance and situation. So these are the things that we haven't been able to kind of build up and before the distance education provide this plan for.
I think that's fantastic. It really does show just how impactful this like distance learning and online integration at AOMA has been. And then also, AOMA is, a sizable school, but much smaller than the University of Texas at Austin. And to have such a big and well-known institution feel confident and safe in sending their students to our space is just, it's such an honor. And it has been a even better honor to sit down with you guys and talk and celebrate Acupuncture and Herbal Medicine Day. Do you guys have any closing regards to our conversation? Also, where can people find you online, or how to book appointments with you at the clinics or learn more about the AOMA programs?
Okay, I'll go first. Let's see, there were a few things in there. One, closing thoughts. Chinese medicine, as I often tell students, it's not something that you go and do as your job. It's also a whole different worldview. And when you're practicing the medicine right, you're practicing it all the time. You can see it everywhere in the world around you, in the environment, and the people that you meet, and of course in our patients and students and everything else. So Chinese medicine is a wonderful system for thinking about the human body. And so I would say if you're listening to this and you're thinking about going to acupuncture school, then by all means get in touch with us. You can find admissions information on our website, which is aoma.edu. You can also contact our admissions department directly. Reach out. In terms of how people can find me, you can find me on Facebook at Dr. Phil Garrison. You can find me on Instagram also as Dr. Phil Garrison, and I have another project on Instagram called Curating the Neijing, where a colleague of mine and I post translations and commentaries on different aspects of one of the foundational texts of Chinese medicine, which is called the Neijing. I think I answered all the questions, and I can pass it along to Violet now.
Thank you, Phil. And I just wanted to add is that because I'm one of the practitioners here at AOMA's clinic. We do have both North and South clinic in Austin area, and we are having a whole team of practitioners. And so for book appointments, you can totally just like reach out to AOMA clinic and book appointments. And not only me, but we have practitioners who specialized in different fields, and they are experts in their fields. So that's just something that I also wanted to bring here.
Yeah, no, I think that's fantastic. And definitely a nod towards the clinics, North and South, and also to the people's community clinics, and also to the VA, as Phil had mentioned. There are a number of places that you can find AOMA practitioners and collaborations, as well as we are now in our 10th year of working with the McCarthy Clinic, which is fantastic. So there is no expense to which that you can find a way to, better enrich yourself and heal yourself with acupuncture and TCM through AOMA. And I just want to thank you guys again for sitting down with me today and celebrating Acupuncture and Herbal Medicine Day.